EMS workers in Durham earned nearly $2 million in overtime in just a year.
It's a testament to how short-staffed they are and to how many shifts that workers have to pick up just to make sure someone can respond to emergencies.
WRAL Investigates Sarah Kruger is asking what the plan is to bring them relief.
As calls to 911 skyrocket with population growth in Durham County, there are not enough ambulances or EMS workers to respond to all of the emergencies. Radio traffic from Broadcastify makes that clear.
I know we're backed up, so I need to wait for a few. That's fine.
Some of the less serious calls are put on hold.
To people who are going through a medical emergency, it could feel like those minutes really matter.
Durham resident Sterling Clark feels for the EMS workers who are stretched thin.
They might be short, but they are trying their best.
Obviously, we don't want anyone to have to wait. Unfortunately, that's the situation that we found ourselves in. And
Mark Lockhart is Durham County's Director of Emergency Services. Lockhart says out of 179 positions, 39, or about 22%, are vacant. Knowing about the staffing issues WRAL Investigates has covered for years, I filed a public records request with Durham County asking how much overtime was paid to EMS in the latest fiscal year that ended in June. The response, a staggering $1.7 million, coming from more than 34,000 hours of overtime worked, with one employee earning more than $42,000 in overtime alone. Equally surprising, that spending came in under budget of the $1.9 million the county allotted EMS for overtime.
How do you balance, we as a county obviously need people who can come help those among us who have emergencies, but your staff also needs a break.
it's a physically demanding job. It's mentally very stressful because you're, in some cases, making life or death decisions.
Lockhart says they talk openly about mental health and have a peer support program. I asked other EMS agencies in the area if they're holding lower level calls too. Some are. Wake County saying it too sometimes has to hold calls in which the patient's health status is stable. The problem is staff are hard to find, and so are the physical ambulances.
The ambulance manufacturing industry is still recovering from the pandemic. When we order an ambulance today, that vehicle will not arrive in Durham for 3 years.
What is the solution here?
We've got to do a really good job at recruiting and making sure that the pipeline of incoming employees is solid.
It'll take more people like Sterling Clark, who says it's his dream to be an EMT.
So you're planning to apply to Durham County EMS?
Yes, ma'am, I am. I'm currently at Durham Tech right now, so I'm working towards my GED, and then I'm going to go into EMT school.
A new group of about a dozen recruits starts this week. The onboarding process takes about 2 months, but still, it's progress in the right direction. Sarah Kruger, WRAL News in Durham.
And WRAL has been reporting EMS spending issues and staffing shortages for agencies all over the Triangle. You can find a more detailed breakdown of the numbers and which counties are seeing a strain on resources on WRAL.com.